Hello and welcome to this webinar. Today we'll be asking the Doctor of Physics. So this is an opportunity for you to ask a Doctor of Physics about human temperature screening, what it can, and as importantly, what it can't do. I'll be the host today. My name's Christopher Leonard. I'm the Global Lead for VIRALERT at AMETEK Land. And I'll be joined by our Head of Physics, Dr. Fiona Turner. So just to give you some background about AMETEK Land, we've been in non-contact temperature measurement for over 70 years. We have innovation stretching back to 1947. Equipment is designed and manufactured in our UK headquarters, along with world-leading calibration facilities. We have bases in the US, throughout Europe and the Far East. We're a trusted manufacturer with facilities local to your installations. In addition to our non-contact temperature measurement work, we've also pioneered human body temperature measurement dating back to the original SARS epidemic in 2003. Indeed, at this time, we patented what has become the gold standard in terms of human temperature screening, known as in-scene calibration. This is the use of a precision engineered black body, which we'll cover in a little bit more depth as we move through the presentation, to make sure that you're getting reliable, repeatable readings in real world situations. We're now approaching over 1,000 of these systems installed, starting back in 2003 with the SARS epidemic. Since then, there has been the MERS, the Middle East respiratory syndrome, as well as avian flu and swine flu. So introduction, which I'm sure we're all very familiar with. COVID is a major challenge for economies to reopen and to remain open without causing resurgent spikes of infection. Temperature screening, alongside other mitigation methods such as social distancing, hand hygiene, and face coverings, can play a key part to halting the spread and controlling COVID-19. So just let's, before we jump into the temperature screening, just explore some of the other mitigation methods, their benefits and limitations. So social distancing. The Lancet's reported that social distancing dramatically reduces the risk of disease transmission. From 13% at 1 metre, dramatically reducing with distance greater than that. However, today we're looking at potential applications within the sports arena, and maintaining those social distances can be difficult, if not impossible. So whilst it's a good mitigation method, it's not always possible in all situations. Hand hygiene. The World Health Organization reports that the virus is very persistent and resilient. It can last from 2 hours to 9 days. Hand hygiene is good, but it's only as good until the next time that you touch potentially an area of infection, such as your face, around your eyes, nose or mouth. And that can happen inadvertently without thinking, up to 20 times an hour. So hand hygiene can be a great mitigation method, but again, with social distancing, they're not infallible. The third mitigation method, often recommended and used, are face coverings. Again, these can be very effective in stopping the spread of transmission. However, they tend to be one size fits all. That means that the size and fit of the face mask can be very variable and less than ideal. And indeed, if you don't treat the mask with real clinical rigor, making sure that you're not touching the outside of the mask when you're taking it off, and potentially increasing your own risk of infection, they're again fallible. So all of these measures will dramatically reduce and mitigate risk, but they cannot eliminate it. And all of them have limitations. So with that, I would now like to introduce our Doctor of Physics, Dr. Fiona Turner. These products are applicable for a wide range of uses, as you can see from the slide, right across from healthcare, commercial, and into the sports and leisure arena. And Fiona's going to help us understand a little bit more around the benefits and limitations in those type of environments. So this is Dr. Fiona Turner, our Head of Physics at AMETEK Land. Welcome, Fiona. I was wondering if you could just help our audience understand a little bit more about the benefits and limitations of temperature screening. The first area that we would like to cover is non-contact handheld thermometers. So if you could give us a little bit of explanation on their benefits and their limitations for use as a screening tool.
Okay, well there's two basic sorts of the handheld thermometer. There's the medical sort that if you go to a hospital at the moment, probably a trained nurse will be measuring inside your ear cavity with one of those thermometers. You might have one at home. Those are very accurate, very good, because they measure within that ear cavity. So there's no conflicting radiation, no reflections. You can't be a different distance from your own ear. It goes right inside. Very reliable. Accuracy normally about 0.3. But that nurse or other measurement person, or if you're using it yourself, then it's your own hand that has to pick it up and then put it down for somebody else to touch it. Or the trained nurse or somebody at the entrance to your facility has to get really quite close to you. So the social distancing is difficult. There are other handheld units that you can use them from a metre away. Those are less accurate. It's a one-spot measurement, but that variation in measurement distance, and according to the person who's using it, the variation in whereabouts on the face that they actually point at, that introduces further error into the, well, uncertainty into the measurements. The problem with this temperature screening for fever measurement is that you really need to be so precise, because the difference between 37 degrees and 38 degrees might be a fever starting, or a 37.5 might be acceptable in hotter weather, and 38.3 would be an alarm condition that person wants to get themselves tested. So we really need that absolute precision to be able to say whether somebody's healthy or feverish.
Okay, thank you. That's very enlightening. So I think to sum that up, the issue with the non-contact handheld thermometers is accuracy. They can be plus or minus 2 to 3 degrees, 2 degrees Celsius plus or minus, or 3.6 plus or minus Fahrenheit, which, as you say, could give you some false positives or negatives. So you're inadvertently stopping people entering a facility when they're not exhibiting a temperature or a fever. Or
and the handheld is the problem, the hand that holds them.
Okay, so that is violating one of the other mitigation methods in terms of social distancing. So the person carrying out the measurement is at a higher risk of infection, and should they become infected, then you're increasing the risk that everybody that comes into the facility. So rather than mitigating risk, you're potentially creating a greater risk there using that type of process. Okay, thank you. One of the other areas, one of the other questions that we've been asked about at the other end of the scale, I think handhelds are seen as quite attractive. There's a low cost of purchase, but what's often not considered is the cost of ownership, paying somebody wages to carry out the task, and then beyond that, the violation of other mitigation methods and potentially causing increased infection. At the other end of the scale, one of the questions that we've been asked is about multi-person or crowd scanning. So I was wondering if you could share some of your expertise and knowledge around the suitability of multi-person or crowd scanning in temperature screening environments.
Okay, this is another product family that we have chosen not to offer for the COVID screening ourselves. We at AMETEK Land, we do manufacture some great thermal imaging products, lots of pixels measuring the temperatures. We use those in industrial applications, measuring steel and glass plants. So we could have gone down that route for the thermal temperature screening for people, and we chose not to. The cost goes up with the pixels. So if you want to measure a huge crowd area, then you've got to have quite an expensive unit. And then there's the uncertainty how far away somebody is. And if you want to scan a crowd, you've usually got to mount the camera up high, looking down on people. And some people have more hair than others. Some people in this room have slightly more hair than others. So that's going to be a bit of a problem, because you'll see more of face area from some people than others. And the perspective will mean that everybody's at a different distance. And the best thermal imager in the world is suffering from a slight amount of size of source effect, we call it, that a bigger hot area will affect the camera.
So the closer to it you are, the hotter you will appear.
Yes, yes. The better cameras have a very slight effect, but they all suffer from it, because you can't, within a thermal imager, you can't screen every pixel properly, or you'd end up hiding the view of the adjacent pixel. Okay. So it's unavoidable.
Okay. Could you share a little bit of your knowledge? We're going to cover it in a little bit more depth when we move on to our recommendations for temperature screening. But could you share with our audience a little bit of knowledge around the purpose of a black body source within a temperature screening system, and how that could be a challenge in multi-person or crowd screening applications?
Well, it could be used in a multi-person or crowd scanning application, but it only works well if you can use the black body so that the person can be directly compared to it. I think I best take a step back here. The black body radiation is a fundamental of physics. It was Max Planck back in 1903 developed the radiation theory, and a black body is a perfect radiating object. So one that gives out energy, infrared energy, according to its temperature, and it gives out all of that energy, and no real object does that. It is a theoretical device, but some black objects get very, very close. So that's the perfect radiator, and according to its temperature, a different range of wavelengths will be emitted, and every warm object emits some radiation with the wavelengths depending on its temperature. So we are all emitting radiation in this room. It is quite chilly in here actually, and Chris and I are busy radiating, centered around 8 to 14 microns, probably, because our body temperature's emitting in that sort of region. Obviously hotter objects, when you get up to 1,000 degrees C, that's a bright white, and we've got right down into the visible region. You start to see an object glowing red hot just over 600 degrees C. And so everybody's radiating. It's probably more detail than you need, sorry, but this is a physics question. Black bodies radiate according to their temperature.
Okay.
And what we use for our recommended system and our patented system is that we use the thermal imager with a black body within that image, where the black body temperature is very, very tightly controlled, so that then you can compare the person's radiation to this very, very tightly controlled black body radiation. And this gets rid of a lot of the uncertainty based on whether you're sweating, whether you have a different amount of face exposed. It serves as an in-frame calibration device.
So it sort of gives real-time calibration.
Yes,
in the real world.
Yes.
Okay, thank you. Just moving on, one of the questions that we've been asked, along with the suitability of handhelds and the applicability of crowd screening or multi-person screening, is what we would recommend in terms of best practice. So this obviously has been very much incorporated into our product, VIRALERT 3. But I was wondering if you could just share with us some of the features that have been designed into the VIRALERT 3 that help give that real-time accuracy.
Okay, well, the black body calibration source in the frame is the #1 for accuracy. And that's coupled with a low resolution thermal imager, which keeps the price down. And it provides face detection rather than face recognition. So we know it's a face that we're measuring, but the police wouldn't be able to find you from the image that we're saving.
Okay.
It is a face that we measure rather than a hot coffee cup.
So just to help our audience understand that, the face detection is an error checking function. As you say, it prevents were you to walk in with a hot coffee cup. Some systems would measure the coffee cup and sound the alarm.
Yes.
Our system identifies and detects a face and just measures that area, so it eliminates those false readings.
Yes.
But then face recognition is much more computer intensive and typically requires cloud services, which then bring up privacy issues because that data and your identifying features are not contained within the system.
Exactly, yes. The VIRALERT could be configured to work with your own secure system. Maybe you use a swipe card to come into your facility, and just by the timing of when the thermal image and the temperature was checked, and if you put your VIRALERT system at reception, then you could use it to couple it.
So it can be,
it would be within the customer's region,
protocols.
And their protocol for that land would not have anybody's personal data who was scanned by it.
Okay.
So we have a VIRALERT system that I can demonstrate.
Yes, I think that would be fantastic. I'll just bear with me with my camera skills, and I'll just pan to the right.
Smoothly done.
Right, Fiona. So what we have here is something that we set up earlier. This is a VIRALERT system that we typically have in our reception. So what we have here is the VIRALERT mounted on top of a standard TV on a standard TV mount. So if I'm here, I'll just give you all a wave. If I could just ask you to walk up and test the system for us, Fiona. So the system's sat there at the moment. I don't know whether you can quite see it, but at the bottom left hand of the screen, it's basically saying, please approach the camera and stand still. So it's detected movement, but it recognises that whoever's in frame, it's probably me at the moment, is not close enough to take a viable reading. So,
whereas if I walk across, you can see the green square has identified my face. It's already, before I finish talking, it's already decided.
Can we ask you to do that again, Fiona, because it was a little bit too quick. So normally the screen is, and I will put up an example on the screen so you can see this a little bit better. I just wanted to show you a live demo of the system in action. So typically the system, it's measuring, the sides of the screen are on grey. When it's identified a face, it flicks onto the amber to indicate it's measuring. And luckily Fiona's on green, she doesn't have to go home. If there was an elevated reading, the screen would flash red. And again, to account for any users that are potentially colourblind, that's backed up by the messaging and the text on the screen, which can be customised to a user's preference. So on green, it will say something along the lines of please go, pass. On a red alert, which I'll show you an example of in just a moment, you'll see that it comes up with a warning message. Right, what I'll do now is I'm just going to run you through a few key points around the VIRALERT product. If you do have any questions, please put those in the right hand side of the screen. You'll see a little section for questions if you enter those there. We do have 2 questions that have come in that we'll cover just after this, but if you do have any questions, please just put them in there. Thank you. So to sum up, all the expertise and knowledge that Fiona has shared with us have very much been incorporated into the VIRALERT 3. We have a dual thermal imager and visual camera. As we've talked about, the black body is integrated into one unit, which means setup is very straightforward and simple. It also takes out the potential for error, looking at trying to establish an algorithm with different positions where you might mount the black body with some of the competitor systems. It's prefigured and ready to go. Plug and play straight out of the box. And it has those features and functions such as face detection, which means the system can be automated. There's no need to have a manned system with this. And it also reduces those false readings. Rapid measurement, in under 2 seconds, and we have market leading availability less than 1 week at the moment. So just summing up those features again, face detection ensures the accuracy, prevents an alarm should an employee or a visitor turn up with a hot coffee cup in their hand. It's privacy safe. It uses facial detection, not recognition. So in terms of privacy, it should all be covered under the existing users protocols. And it's quick and simple, green for go, red for alert. This is a bit of footage, again, filmed from our unit in the reception of our HQ in Drumfield. I'd just like to assure you that no staff, animals or children were harmed during the filming of this scene. We did simulate a high temperature, which you'll see in a moment. So here, as the employees walk up, you'll see that the system detects a face, the little yellow square. It then gives an amber yellow reading message, which then, should the temperature be under the specified level, changes to green and gives them a pass message. So I think it's there's about 2 more readings to go through, and then we've got a simulated high reading so that you'll be able to see what that looks like. So here you see, very quick, straightforward. Now, one of the questions that we've been asked on previous webinars is around face coverings. Number one, the face detection doesn't work without a face covering, and that's purposeful. So this is the simulated high temperature reading. So here you see high temperature detected, and Dave's off to the medical room to seek further advice. The system's very quick, easy to use, very straightforward to set up. The text on the screen that you see here can be customized to suit. So should it be an unmanned station and one of your customers wants anybody with a high elevated reading to contact the nurse or HR, you can put the details into the system so that that's very clear and evident to any users. So in terms of setup, we can supply the VIRALERT as a one-stop solution. You can get everything that you need from us in terms of the system. You can buy the laptop should you wish to from us, as well as the various ceiling and wall mounts. Or there's a flexible menu set up. You can buy the system and source the accessories and laptop through your own organisation and normal channels. We offer a ceiling or wall mount and also a clamp type mount. So what you see here on at the right of the screen is a setup with a tripod that would be very flexible in terms of moving it from location to location. If you've got a fixed installing, such as a reception or an access area, and ceiling or wall mount may be more applicable. We also do a desk mount, which makes mounting it onto a reception desk very easy. It maintains social distancing, doesn't violate the other mitigation methods. So you're adding risk mitigation rather than taking it away. It enables quick readings for high volume. And also the software is very intuitive and easy to use, absolutely minimum to no training required. And we also look to provide additional support material to help the installation. So in terms of points of measurement, marketing literature to make it very clear in signage, in terms of the process, what people are expected to do. One of the points that I was just going to touch on in terms of face coverings, the reason why the system has been designed only to work when removing face covering, that's following best guidance from the likes of the FDA and other reputable sources. The reason for that is a face mask can either hide areas of high temperature on the face, but what is more likely to happen with the face mask is venting at the side of the nose, which can give a false high reading. Therefore, we recommend removing of face coverings and glasses in line with that guidance. If there are any questions, I'm open to taking those now. We do have one quick question that I'm just going to flip back to our expert host to help us with. So Fiona, I think we've touched on it, but it is a common question. We are used to dealing with heavy industry and very energy intensive applications. And I think one of the questions that has surprised us a few times that we've been asked with people that are less familiar with this type of technology is, does the technology irradiate them? Does it in any way affect them? Is it in any way harmful?
No, not at all. Our products don't emit anything, well, anything more than a standard, an electric torch would, or no, that's a bad example because that is emitting light. I mean, and your mouse, your keyboard, there is electrical currents in it, but only at that sort of level, only the 3 volts. There is no radiation coming off it for the infrared measurement. It's not like the detectors on your car, which emit infrared and then look for reflections. Our products, all of them, even the high energy steel and glass products, they're just measuring.
So they're passive.
Yes, it's almost whether you're going to damage the instrument because you're radiating. It's the other way around.
Thank you. So it's a passive measurement. In terms of safety,
yes.
It has no effect whatsoever. Okay, Fiona, thank you very much for sharing your expertise with us. I think that's about it for the questions today. Open offer to the audience. Should you have any questions that occur to you after this, please feel free to get in touch with us. We're here to help you select and make the right decisions for temperature screening equipment for your applications. In the UK, I think there's been a little bit of a delay in terms of the proposed opening for some of those sports stadiums. We have a couple of installations, one at the local tennis club and one that's gone into the rugby and cricket ground in Leeds, in Headingley, if you're familiar with that. We've got track record, we understand how to implement these systems to give reliable and repeatable results in those type of environments. So should you have any questions, please feel free to get in touch. And thank you very much for your time today.